Detroit's Cass Corridor, it's the Metro on WDET. I'm Kerry Jr. II.
And I'm Robyn Vincent. Today on the show, Hospitality Included Fest is coming up, and it's more than food. It's the story of Detroit told through flavor and sound.
Plus, Motown-bred singer Beth anoints us with her velvety voice just ahead of her performance tonight at Sounds Like Detroit.
Also, the Trump administration wants to reshape museum narratives, limiting critiques of the president and shifting focus toward American pride.
We'll unpack how this could affect local museums, communities, and American life.
But first, for years, pharmaceutical companies have been making people sicker. That's because they pushed their drugs onto people and doctors, which increased addiction rates and overdose deaths. Now, this happened across the country and here in the state of Michigan. Last month, a national settlement with Purdue Pharma created new funds for drug treatment in Michigan. The state is expected to receive $154 million over 15 years. The new funds will go to a larger pot of money from additional national settlements with opioid manufacturers and distributors. Now, this money comes at a really pivotal time. That's because Michigan is set to lose over $90 million from cuts to federal grants for substance use disorder programs. That's according to our state's Health and Human Services Department. So, where will the state's new opioid money go? And what do we need to do to both prevent addiction deaths in the short run and to prevent addiction entirely in the long run? To discuss all this, we have Steve Norris with us. He's the founder of the Recovery Collective in West Bloomfield. Steve, welcome to the Metro.
Thank you. It's great to be here with you.
So, Steve, Michigan is expected to receive over $178 million in new opioid settlement funds from drug makers and distributors. I'm wondering, what was your reaction to the settlement?
Well, I think it's a wonderful addition to the already $1.6 billion from the original. And it comes at a very, very crucial time. As you mentioned, a lot of funding is being cut for some of those areas. And so this money is going to be very, very important and influential on how we kind of determine the next direction of where we're going.
Can you talk a little bit more specifically about how you envision this settlement money to impact the Recovery Collective and agencies like yours?
So that's a really good question. I try not to think from a selfish perspective, of course. However, we hope that we're a part of influencing the guidance and direction of the proper spending of those funds. I would hope to see that our local jurisdictions, communities get the lion's share of those fundings and put it directly into the pockets of the people that have been affected. However, we haven't necessarily seen that in other areas. So we need a really good sense of oversight so that we can manage the way that those funds are distributed throughout the community.
So as the leader of the Recovery Collective and its founder, do you receive some of this funding for your work?
Not yet.
Okay.
There most likely will be at a local level RFPs that go out to say, hey, who is interested and how will this money be spent? I've certainly put a lot of thought into how we could make an impact for our communities in obtaining some of those funds so that we can directly make those impacts ourselves. And so that question for us kind of remains a question mark. Do we stay in a place of accountability, or do we receive those funds and then drive that change from the front? Those are questions that I'm still pondering in this moment.
Speaking of questions to ponder, this moment feels uncertain in a lot of ways. And specifically, I'm thinking about the cuts that the Trump administration has been doing. One thing that they've cut is grants. A lot of those grants went to universities, but there have been other institutions and nonprofits that have been impacted. I'm wondering, how have grant funding cuts affected health providers who treat people addicted to substances? What you know about that?
Yeah, so there are a lot of changes that are happening. What I've seen that's been quite impressive and beautiful is a collection of leadership coming together to say, okay, these changes are on the way. What do we do to take action now so that we're not behind the eight ball when these things occur? So in Oakland County, at least, there's been quite a few of those stakeholders coming together to come up with plans if those things were to happen. However, most of the people that I've communicated with, they're in fear of that happening, but it hasn't yet occurred. So the writing's on the wall. We need to be well prepared to be able to respond to those things and then take action and figure out as a community what we're going to do.
What are some of the ways that providers are talking about this, or what are some alternatives, I guess, is the question.
Yeah, I think that's the $1 million question for everybody. What are those alternatives? The ones that I see, and one of the reasons why I love serving in Michigan, especially around the Metro Detroit area, is that we can heavily rely on our community base to come together and pull local resources to make a difference where federal and state funding has been gapped. And that call to action to our community to really rally and champion around each other and push these initiatives forward is going to be crucial in how we respond. So that would be my answer in this moment. However, there's so many question marks as the landscape changes at a rate I don't even think any of us can keep up with. Going from one chaotic situation to another and remaining focused has been, at least for me, a bit unsettling.
And then most importantly are the folks who have substance use disorder or other mental health issues and how they're potentially going to be affected. I mean, what could these cuts mean for those folks?
Yeah, so that's the devastating part.
Yeah.
I know from my own experience, when you're in the midst of those things, these are the issues that you're not really paying attention to and not focused on. What it means to them is lower levels of care, lower levels of access to the things that are vital for sustaining their life in the midst of their chaotic substance use. And so for them, those impacts could be anything from the lack of direct connect to services that are available. Perhaps it could be the minimization of medications used specifically for opioid dependency, and the less staff available to be able to connect with them as a human being and find out exactly what their specific needs are so that they can tailor a program that works for them.
You mentioned your own experience, and I'm guessing that was with addiction?
Yes.
What do you want people to understand about the barriers to getting help and support that already exist based on your own experiences?
Yeah, so for me, addiction was a very isolating situation. And the challenge for me was being able to actually open up and say, I'm struggling and I need help. Excuse me. So with that said, being able to open up our hearts and be able to come together with people that are in the midst of that struggle and say, listen, I shared that burden, or I share that burden with you, so that we can help them find what works for them. That was the thing that saved my life at the end of the day, was that one-on-one human connection of somebody saying, I know what you're going through, and if you want to do something, I'm here to walk with you, and I'm not here to judge you.
So it was losing that feeling, removing that feeling of isolation, understanding that you're not alone in what you were facing and that there were options out there for you.
Yeah, and those were certainly options that I wasn't aware of, right? Because I was in a place of survival for myself, especially when it came to opioid dependency. every morning I was faced with the fear of being so ill that that fear alone drove me to just be able to be okay in the minutes. I couldn't even think about the hours or days ahead. So those choices in my mind were not available, and I needed someone to help navigate those things with me.
And that's why you're now making those choices easier for other folks to get access to, I'm guessing, with the Recovery Collective.
Absolutely. I mean, at the forefront of our work, that is the work, as well as sharing that perspective with people that are in these spaces that may not have that direct lived experience, but they may have the educational background to be able for them to understand what it's like in the mind of someone who's struggling in those areas, can be very helpful with providing them a different approach.
This is the Metro on WDET. I'm Robyn Vincent. My guest is Steve Norris. He's the founder of the Recovery Collective in West Bloomfield. We're discussing national opioid settlement money that's coming to Michigan, what will happen with those funds, and how to resolve addiction at its root. So some good news is that Michigan has seen a decline in overdose deaths for 3 consecutive years, with just under 2,000 deaths last year. That's compared to almost 3,000 in 2023. The biggest thing that Michigan has done of late to help people addicted to opioids is invest in the overdose drug Narcan. That has at least been preventing people from dying, which is wonderful. But we need to do more to develop long-term solutions to drug addiction. Steve, if you had a pot of money that you could put toward anything, what would you put it toward to stop and prevent drug addiction in the long term?
Great question. And, you know, I am so proud of all of the community partners that drove that naloxone distribution into effect. And we were in a state of triage over this last 3 years. So now that we've seen some of those numbers start to stabilize and hopefully they'll continue to decline, what I would love to see is an approach that's more long-term focused, an approach that's surrounded by a continuum of care that lasts a little longer than that immediate need. And so when we see individuals that finally do decide that they are going to engage in, let's just say, a treatment facility service, and they're done with their 28 days, what is it that we have on the back end to hold them? And those are the areas that I think we need to remain focused on so that we can really get people to a place of well-being.
What is on the back end? I mean, how short-sighted would you say is our approach right now to addiction and recovery?
Well, short-sighted, I don't know if that is accurate. I think that we have taken a position to really dig into the data to see where those gaps in services are. And once again, you know, from counties to nonprofits that have taken the time to look, we can clearly identify that there are certain gaps that exist in that continuum of care, whether it be recovery community organizations, the lack of sober living facilities and or structured living facilities. Those things we can say, okay, yes, these don't exist, and we need to place emphasis on spending towards those things, because the longer we can walk with people throughout that journey, the higher level of success they'll have.
But right now you're saying, though, there are a lot of those gaps. And because of that, it has fallen on organizations like yours to try and fill them in, to try and see where these big missing supports are.
Yeah. You know, that is one of the things. And this approach has to be truly collaborative. And when I say collaborative, I mean co-laboring. Not one of the organizations out here has the ability to solve all these problems independently. But as a group, we certainly have the ability to come together and say, okay, these are the things that you are really good at, and we'd like you to own this and take charge of it. So we can advocate for those things. We can identify them, and then we can come alongside those partners that have the ability, the staff, the funding, and try to encourage them to do those things. And that is really the focus for us in this next 3 to 5 years.
I want to look one more time just at the system for a moment. Right now, we put a lot of money toward drug treatment in Oakland, Wayne, and Macomb counties in jails. That's because a lot of people are addicted to substances in our jails and prisons. Do you think we should be incarcerating people who've used drugs? Should we be encouraging these folks to be in treatment centers or mandate that they be there instead?
Oh, what another really touchy subject for me. And, I don't want to hang myself here. Let me answer this the best way I can. Do I believe that punitive measures are successful in getting people to address issues that they're scared to address? And the answer is just no, hard stop. Sometimes they're effective, but not always. And so when we're looking at these things from a criminal justice lens, the criminal justice lens is not set up appropriately to handle these issues. And so sometimes those measures are necessary, and they were very successful for me in the end. However, I think that there's a better approach, and there are more options out there based on what we know that should be presented and utilized other than using our law enforcement or public safety partners to become experts in this very, very complicated scenario.
There's a better way. I think that's something for us to really think about. My last question for you, Steve, with Michigan's opioid crisis at a turning point, new settlement dollars arriving as federal funding disappears, I'm wondering, what's the single smartest investment we could make right now to save the most lives and potentially stop addiction before it starts?
Wow, you're hitting me with some whoppers this morning. I think we need to look at root causes. And when I talk about root causes, what are the things that drive people to unhealthy coping mechanisms? So if I were to say one of the best ways that we could utilize and make a severe impact to keeping people and navigating them away from some of those things is in education and prevention arenas. So having very difficult conversations, sometimes very uncomfortable conversations with people and our youth prior to them choosing a substance or experimenting with substances that they don't understand the gravity of how that can affect them later on, could be a very, very good way of addressing that.
Steve Norris, founder of the Recovery Collective in West Bloomfield, thank you so much for joining us on the Metro.
Thank you.
This is the Metro on WDET. Here at Detroit Public Radio, 2 years ago, we launched our annual listener survey. Your responses informed big programming changes at WDET. We added several new programs, including the Metro, what you're listening to now. Your survey responses inform directly what you hear on these airwaves, so let us know how we're doing. Go to WDET.org/survey. And as we've been discussing, drug overdoses are down nationally, and they're way down in Dearborn. Overdose deaths have decreased 43% in the last few years. Up next, a conversation with the city's public health officer about what's driving that success. That's next here on the Metro. Stay with us.